Hello, class, and welcome to Pharmacology. I'm Dr. Kathleen Muglia, and I am so excited to be teaching you this course this semester. I've been a nurse for 27 years, and I've been a nurse practitioner for the last 22 of those years. So I've administered a lot of medications, I've prescribed a lot of medications. I've seen wonderful healing effects from different medications, but I've also witnessed some devastating effects from medications, medication side effects, and so forth. So giving medications is a huge part of what nurses do, and many times nursing students may feel like they're in clinical is just giving pills. But there's a lot more to it than this. Thinking like a nurse and thinking, what should the nurse be doing before you give a medication, during a medication administration, and after? Assessing your patient every step through the process is really what pharmacology is all about. It's not just giving pills. So during the next 16 weeks, we're going to be learning a lot about pharmacology, starting with some of the background information, the basics, like how drugs are passed through the FDA, how they are named. Then we're going to go into pharmacokinetics and dynamics and what happens with drugs in the body, how drugs actually help patients heal, and then really thinking about how nurses need to think about different classifications of medications and what that process is. So during this semester, we will be using this Kirch text, 7th edition, Focus on Nursing Pharmacology. It's an excellent text. I'm really excited to be using this. And it comes with the Lippincott, The Point, Wolters Kluwer resources, and many nursing students really appreciate those Lippincott resources, saying in clinical it's one of the best resources, that Lippincott advisor that they use with their patients during clinicals and then in their didactic courses. So make sure that you are utilizing all the resources that come with that Lippincott, The Point. There are also lots of questions that you can access. There are more videos. There's just a ton of different resources within there. There's a virtual simulations, PrepU, adaptive quizzing. So this product comes with a lot. So we will be utilizing all of the resources throughout the semester. So how will you learn everything that you need to during this 16-week semester? Well, here are my top 10 tips for a successful semester. So number 1, you will want to do your readings. There are no PowerPoints in this course, so you need to trust me from this process. This is a little different than what some students are used to. Many students say that they attended in their bachelor's program or their previous master's program even traditional courses where they were given PowerPoints and readings, and that's not how this course is set up. It is active learning, so you will definitely need to do your readings. So use those reading guides that we have put in the course for you. So you don't need to memorize the entire text. I will tell you what you need to know by looking at those reading guides. So as you're doing the readings, focus on what those questions are in the reading guide and go through your readings, focusing on those areas for sure. Number 2 is watch all the videos. So we have found excellent videos that have animations and show you how the different processes are happening within the body. So it's a wonderful way to learn. Instead of me just explaining, okay, absorption for a medication is this way. We show you through animation videos how that actually looks in the body. So I'm really excited for you to utilize all those videos. Number 3, complete the self-assessment questions in the modules. These are ungraded, but it is expected that you do them. It's kind of your own self-check to see how you're doing. Do not look up the question, look at the question and look up the answer. Do your best on those questions. You can take them as many times as you want, and your grade it's not graded, but I will be looking at the answers to see where are those concepts that students are having a hard time with. I will then be focusing my exam reviews, my communication with all of you to make sure that you are understanding those concepts that I could tell that students are having a hard time with. I've been teaching this course for quite some time, so I kind of already know what the sticking points are, but I'm going to really be looking individually and as a class what issues you're having trouble with, so I can make sure that you know those points before the exam. Okay? Number 4, the virtual simulations. These are so cool. Most students find them very useful in their learning. So it's the use of avatars, and you are placed in the patient room, and you are given a patient chart, an electronic medical chart, and you're given the case study. So they're live case studies that you can practice with. They take a little bit of getting used to, so just be aware of that you need to find the button on where you want to click, you want to assess your patient. You have to find the button on where. So once you go through it a couple times, you'll see what I'm talking about. And I'll go into more detail on that later, but those are really fun. Number 5, the Prep U questions. Prep U is an adaptive quizzing. So again, this is an exciting active learning tool that's individualized for you. So you will have a question on Prep U, and this is again through your Lippincott advisor. And if you get the question right, it'll give you a harder question. If you get the question wrong, it'll give you another question of the same level. And you keep taking questions and answering questions until you achieve a level of a 3, which is a pretty low level. You want to do 5 questions at a time, and then you want to go back and see what you got wrong. I'll go into more detail about the Prep U's again more thoroughly later. Number 6, Quizlets. So I've designed Quizlets for you. I know a lot of students like to study with Quizlets and make their own Quizlets, which you're of course welcome to do. But I took the most important information from the chapters and put them into Quizlets. So you'll want to utilize those. Students have found those very beneficial in the course because there's a lot of content in the chapters, and you want to make sure that you're studying what you need to. And the Quizlets are just the lower order, more definition style studying. So you are able to answer those higher level questions on your exams. Number 7, medication teaching videos. So 2 assignments you have are actually going to be you recording yourself, pretending like you're teaching a patient about a medication, and then the second video is pretending you're teaching another nurse about a medication. Your language is a little different depending on who you're talking to. And again, I'll go into more detail later about that assignment, but that is a way for you to practice how you are teaching your patients about medications. Number 8 is Kaplan. So this is a 60-question multiple choice NCLEX style question that is provided by Kaplan, and it is nationwide. Students take this type of exam. And it's worth 5% of your overall grade. You have your Kaplan book, which will also help you prepare for this exam. But the content that you're learning in this course prepares you to take that Kaplan. So it's not like you need to study something different. It's on pharmacology. Number 9, study drugs in classifications. A lot of students see the medication list that is all the medications covered in this semester and freak out because they think, how am I going to memorize 300 medications and all of their side effects and all of their indications? How am I going to do that? Well, the way that you do it is you study the drugs in classifications or categories. Excuse me. So you will learn what is similar about that classification and learn the common side effects for that classification of drugs. So as we proceed through the modules, you'll see what I'm talking about, but you do not have to memorize 300 individual drugs and their individual side effects. Number 10, the last tip, is the discussions, the KWL. KWL discussions, I don't know if you've been part of online courses before where you have discussion posts where students will post something and then they end the conversation, or they have to post a reply and they reply to their first peer that that post something and then they leave the discussion. So that's not the intention of discussions. The intention is to actually have a discussion. Like if we were in class together, we would want to have a great discussion about our individual expertise areas. We would want to have discussions about what we are interested in learning. Because we don't have that ability, we're not in a traditional brick and mortar classroom, our online classroom is where we are going to have robust discussions. And that's really what makes these online discussions so beneficial to your learning. So it stands for KWL stands for what you know about a topic, what you want to learn, and then what you have learned. So this again will become more clear as we start those discussions. And I have a bonus for you, number 11 tip on success, and that is engagement. We want you to be engaged in this course. In order to be successful in this course, it's very important that you are engaged. Ask questions, study with your peers, form study groups, attend the exam reviews. Any resource or anything that we have available, we want you to utilize. You will have 5% of your overall grade as your engagement and discussions grade. So we'll talk more about that later, but it's very important in order for you to be successful, for you to be engaged in this semester. So my goal is your success. You do have the tools to be successful. This course, remember, may be a little bit different than what you are used to, but trust me, trust the process. You're going to have fun learning this semester, I hope, and your learning, most importantly, will stay with you. So you won't complete this semester and forget everything that you learned. Through active learning, this is the way that this is done. So how to contact me. My email is the best way to contact me, and that's kathleen.muglia@marquette.edu. I do return emails fairly quickly, usually. Please allow up to 24 hours during the week for me to return an email. If it's during the week and I have not returned an email within 24 hours, most likely I either didn't get it, it went to my junk mail, or I started replying, or I thought I replied and I didn't, because that is not like me. I reply to all emails within 24 hours the most. So please email me again and say, hey, I just wasn't sure if you got that email, and then I will most certainly reply to you. During the weekends, if you could please allow 48 hours for me to reply. Again, it usually does not take me that long to reply to emails, but sometimes I do have some family obligations or other things going on that I may not be able to get back to you within 48 hours, but please let me know. The other thing is Thursdays is my day for scholarship. So as a professor, part of our job is to do scholarly activities. So that is doing presentations, writing papers for manuscripts, writing any type of scholarly articles, service work, all of those things. Thursday is my day for my scholarship. So if you email me, if you have an issue on, so try not to have any issues on Thursdays, but if you have an issue on Thursday, I probably won't reply to you until Thursday evening or Friday morning. So just know that. So try to have all your crises on Monday, Tuesdays, Wednesdays, or Fridays. I think that is it. It is. Have a great semester. Take care. Bye-bye.